recognized as the biggest health opportunity of the century. So not only as a threat, but also as an opportunity, because responding to climate change actually brings immense benefits for human health, with cleaner air, healthier diets, and more livable cities. So the Lancet Countdown tracking progress on health and climate change exists since 2015 to monitor this transition from threat to opportunity. And every year, our findings are published in the Lancet Medical Journal ahead of the UN climate negotiations. And our data makes clear how climate change is affecting our health, the consequences of delayed action, and the health benefits of a robust response. And our work has a big range of activities and objectives, including ensuring that policymakers have access to high quality, evidence-based guidance, and also to support and provide tools to health professionals in order to improve public health. And our collaboration has a big network. We are about 38 organizations around the globe, but also in South America, we have a growing network, and I will share with you more about it later on. But we have a big network that brings together almost 100 scientists across the world, including climatologists, geographers, mathematicians, physicists, transport and energy experts, engineers, economists, social and political scientists, and health professionals. So as you can see, we incorporate a large scope of professionals and areas, and that is because climate change affects everyone, and it needs interdisciplinary solutions. In May 2020, the Lancet Countdown launched its South American chapter, which I belong to. And the Lancet Countdown South America exists to advance research on health and climate change in the region, to encourage regional engagement, and to challenge countries to respond according to the evidence. It is the only academic center in South America that specifically does research on climate change and health, and it's based in Clima Center at the Peruvian University Cayetano Heredia in Lima, Peru. And we are a growing network. We have people from Peru, Chile, from Argentina, from Colombia, from Brazil. So we are trying to engage and incorporate as many scientists and young researchers as well from South America. And basically, we work across 3 axes. We work for capacity building. Basically, we have been building in South America a network of academic institutions so we can collaborate together on climate change and health. We work on the promotion of research by development of case studies, indicators, and also an upcoming regional report that also has as our global report has, indicators that track the progress on climate change and health. And of course, we have to communicate the work we do, because I think that is a key aspect of the work we're doing. We produce evidence, but we have to communicate that, and to communicate it targeting decision makers. So we have this year, we are launching around 6 policy briefs in South America and about 15 globally to engage with policymakers. So basically, we have 44 indicators that track progress on climate change, which are grouped in 5 big categories. Our first category tracks health impacts of climate change. It looks at health hazards, exposures, and impacts. We also have a second group of indicators focused on adaptation, planning, and resilience for health. A third group of indicators that focus on quantifying and tracking how mitigation action impacts benefit or has health co-benefits. And also we are adding, we have a group that has an enormous value because it is focused on economics and finance. So the economic costs of climate change on health, and also the economic opportunities on the transition to zero carbon economies. And the last group, it's on public and political engagement. So we try to measure, we are measuring there different types of engagement, from policymakers, scientific engagement, civil society engagement, media coverage, and corporate engagement as well. So basically what I'm going to present to you now in the minutes that I have are the main findings of the 2022 global report, which is called Health at the Mercy of Fossil Fuels. And I bring some indicators that I think are relevant for the panel of resilience, which I am focusing on impacts of climate change on health and therefore the need to adapt, and also some other indicators that are looking at adaptation strategies and potential impacts to health. And I'm focusing these indicators in Turkey. So the 2022 Lancet Countdown report, in its 7th iteration, is published amid a deep and coexisting systemic global crisis. Countries and health systems continue to grapple with the health, social, and economic impacts of COVID-19 pandemic, along with the Russian invasion of Ukraine and the continued over-reliance on fossil fuels. All of these are coexisting crises that have pushed the world into an energy and cost of living crisis. And while these crises are unfolding, climate change is still there and is intensifying. The worsening of its effects is increasingly affecting the foundations of human health and well-being, and it's exacerbating the vulnerability of the world's population to concurrent health threats. For instance, during 2021 and 2022, extreme weather events wreaked devastation on every continent, adding more pressure to health services that are already dealing with the fallout from the COVID-19 pandemic. We're talking about floods, major floods happening in Australia, Brazil, China, Western Europe, Malaysia, Pakistan, South Africa, and South Sudan, which caused thousands of deaths, displaced hundreds of thousands of people, and caused billions of dollars in economic losses. And this might sound with the audience from Turkey, but wildfires wreak devastation in many countries, including Turkey, Canada, Greece, Algeria, Italy, Spain, and the United States, and also record temperatures in Australia, Canada, India, Italy, Oman, Pakistan, UK, and Turkey as well. So moving forward, I'm going to present to you around 5-6 indicators that I think are relevant for the discussion of this panel. And the first one is our indicator that tracks exposure to warming. Inhabited lands areas warm up faster than oceans. So by overlapping gridded temperature and population data, this indicator shows that the average temperature humans were exposed to during summer seasons in 2021 were 0.6 higher than the average in 1986-2005. This represents twice the global mean temperature increase in the same period, which was 0.3 centigrades. So in 2000, Turkey had a change of 0.56 centigrades in summer temperature exposure. But now in 2021, the report shows that the population-weighted exposure change was 1.07 centigrades on average during the summer season. Also, wildfires, this indicator, 1:1, it looks at the exposure to days of very high or extremely high fire danger. Wildfires cause a range of health impacts, from direct thermal injuries to exacerbation of acute and chronic lung disease from the smoke and the air pollution. Also, wildfires often cause substantial social and economic impacts, affecting vital infrastructure and emergency services. With climate change, hotter, drier conditions are being created in many parts of the world, increasing then the risk to wildfires. So the results shows that the exposure increased in 61% of countries from 2001 to 2004 to the 2018-2021 average. Turkey is no exception. Exposure to wildfires increased in this country by 171.48 thousand person days in 2018-2021 with respect to the 2003-2006 average baseline exposure, being 1 person day, 1 person exposed to a wildfire in 1 day. Another important topic has to do with food security and undernutrition. The global number of undernourished people around the world has been rising steadily worldwide since 2014. This indicator uses changes in climate to monitor the declines in crop yield potential due to warmer temperatures for 4 major crops in the world: corn, wheat, rice, and soy. So as we can see, there is a global trend in these 4 crops towards a decline. So relative to the 1981-2010 average, higher temperatures in 2021 shortened global crop growing season, specifically by 9.3 days for maize or corn, 1.7 days for rice, and 6 days for winter and spring wheat. Moreover, heat wave days in 2020 were associated with 98 million people reporting moderate to severe food insecurity. But what is it like in Turkey? As we see in this graph, Turkey follows the global trend of reduction in crop yields potential. In Turkey, the reduction has been particularly greater for rice and maize crops. The percentage of change in days of growth for rice was 8.7, well, minus 8.7, and minus 7.5 for maize, compared to a 1981-2010 baseline. This is an indicator that we have on our adaptation working group, and it's city-level climate change risk assessment, because cities and local communities are at the forefront of the health impacts of climate change and therefore must be central to any adaptation response. This indicator tracks the proportion of global cities who have conducted climate change risk assessments and the climate-related health impacts or vulnerabilities that cities identify. Specifically, this indicator draws on data from the Carbon Disclosure Project Annual Cities Questionnaire, assessing the number of global cities that have undertaken a city-wide climate change risk or vulnerability assessment, and the reported climate-related health impacts and vulnerabilities of this city. This is a self-reported, non-compulsory survey, so data provided may be subjective and response rates can fluctuate in case you don't see some cities from Turkey. So the global finding shows that 78% of cities reporting to the Carbon Disclosure Project's global survey had completed or were in progress of conducting city-level climate change risk assessments. So there we have a picture with Turkey, and we can see that it's color-coded. Those cities with green have assessment done, in blue, assessments in progress, in yellow, intending to undertake the assessment, in pink, not intending to undertake, no answer, or do not know. So in Turkey, 8 cities reported having conducted a climate change and risk assessment. So I'm going to say the names of the cities. Probably I will pronounce it incorrectly. So apologies for that. I don't speak Turkish. So cities that have produced this assessment include Istanbul Metropolitan Municipality, Bursa Nilüfer Municipality, Kadıköy, Izmir, the city of Denizli, Adana Metropolitan Municipality, Gaziantep Metropolitan Municipality, and village of Kadiobasik. Another important adaptation measure are urban green spaces, because access to urban green spaces provide benefits to human health. They reduce exposure to air and noise pollution. They relieve stress, provide a setting for social interactions and physical activities, fosters social cohesion, and reduces all-cause mortality. In addition, green spaces also serve as a mitigation measure as they sequester or they store carbon and provide local cooling in terms of adaptation now that disrupts urban heat islands, benefiting, as I mentioned, from both climate change mitigation and heat adaptation. So this indicator reports population-weighted normalized difference vegetation index, the NDVI index, as a proxy for green space exposure in more than 1,000 urban centers that have more than 500,000 inhabitants, or are the most populous centers in the countries underrepresented by the 500,000 threshold, as identified by the Global Human Settlement Program of the European Commission. Green space is detected through remote sensing of green vegetation, making use of the satellite-based NDVI. So in 2021, as a global finding, only 27% of urban centers around the world were classified as moderately green or above. In Turkey, the average level of urban greenness is very low, increasing just a bit in the NDVI from 0.22 in 2010 to 0.26 in 2021, yet still within a very low level. And I think this is my last indicator, which is from Working Group 5 on government engagement and public engagement. And this indicator is focused on measuring scientific engagement. And I am adding this indicator because we will see how are we doing on adaptation research. So basically, peer-reviewed scientific journals are the leading source of high-quality research that then would provide the evidences that media, government, and the public will use. This indicator exists to track scientific engagement on health and climate change in peer-reviewed journals. So what we're seeing here for Turkey is that compared to 2007 baseline, Turkey has increased its scientific engagement. There was a change from about 1 article on health and climate change in 2007 to up to 20 articles on health and climate change in 2021. So globally, and these are the global results, we can see in this graph also that the number of scientific articles published basically since 1990 have been increasing steadily, reaching up to 3,500 articles in 2021. But interestingly enough, we can see here how these articles and this research is actually distributed. We can see in blue the impacts. We can see, we can see here in blue the impacts, in red or pink those articles related to mitigation, and then in this other, I don't know what is that, like green or something, adaptation. So this is something undeniable, that mitigation is basically the main topic there has been research. So basically, we can also see that mitigation would be, let's say, the strongest topic after impacts, not very strong anyways. And lastly, adaptation. So considering the needs that all countries have on mitigation and adaptation measures, it is clear that if we want evidence-guided decisions, evidence still needs to be produced in order to identify the best practices, the best measures to cope with climate change, to respond and adapt to a changing climate, and also to identify co-benefits of mitigation strategies. Finally, as a brief summary of the report, there are 3 key messages that I would like to share. First, according to the report and the evidences that every year this report tracks, climate change is having an increasing impact on the health and the well-being of people everywhere in the world. There's no country in the world that can say, I am immune to climate change. Everyone is experiencing the impacts of climate change. And this is exacerbated by the effects of other coexisting crises, including COVID-19, the energy, food, and cost of living crisis. Secondly, governments and companies in high and low income countries continue to prioritize burning fossil fuels, and this goes in detriment of people's health and well-being. Meanwhile, a profound lack of financing undermines a just and equitable transition to a resilient future and healthy, affordable, zero-carbon energy systems. And finally, as countries craft responses to the current aggravating crisis, the world is at a critical juncture. While the addition to fossil fuels could ensure a fatally warmer future, a response that prioritizes health and well-being and the immediate health benefits of climate action still offers a renewed opportunity to address these multiple crises that we face. The window is closing fast, but still there's some opportunity to create a world where people can not only survive, but also thrive. I think I just made it on time. So thank you so much for your attention, and I look forward to listening to Fen's presentations and to your questions. Thank you so much.
Thank you, Marisol. It sounds interesting. I don't know, have someone in this room want to add or share with Marisol? You can raise hand and open microphone. Prophet, I interesting in your work. I have some question. There are a lot of indicators or many indicators. When you monitor all of these indicators or select the significant dimension. For example, economic select some indicator.
Yes, thank you. So we are a large network, and every year all these almost 100 researchers contribute with one indicator. I contribute actually with one. I didn't present it because I wasn't sure if it would be relevant, but it was on vulnerability to mosquito-borne diseases. But we have around 5 indicators that measure the economic cost of climate change and the economic cost of transition, and also the economic benefits of this transition.
Okay, thank you. I think this work is important because when I would like to use health impact assessment in the scoping step, we have to create an indicator in order to evaluate the positive and negative impact. I think that your work maybe I would like to know how to monitor I mean that maybe some indicator have to have a baseline data, baseline data. Maybe
Yes.
I'm not sure you have problem about no have baseline data.
So yes, maybe I can share my screen again and then I can take you all through it, because I think that is a very important point. If your work is related to climate change and health, and you would like to be able to gather evidence to do your work, I invite you to navigate our website. So I'm gonna put the link here in the chat. And okay, to everyone over there. Okay, so basically you go here to explore our data, and then the dashboard will open, and you have here the 5 topics that I mentioned earlier, and then you just click on them, and then you have like the categories of indicators, and then here you can choose which one you would like to see. And over here you will see the dashboard with different ways the indicator is presented. You can press here in the arrow to look at other graphs, and from there, you can see results based on Human Development Index or WHO region, or you can see it per country. So basically, all of this is publicly available, and I encourage all of you to navigate on this dashboard so you can find the most suiting indicators regarding according to your interest. So as you can see, we have here a set of indicators on the economic impacts of climate change. So we're talking about how much was lost because of climate-related extreme events in terms of economic impacts, how much is heat-related mortality costing to countries, particularly looking at the most vulnerable population, which are those over 65 years old, how much earnings are being lost because of the impacts of labor capacity because of heat, what are the costs of air pollution, specifically looking at the health impacts of air pollution. And then we have this other set of indicators looking at economics of the economics of the transition to zero carbon economics. So how much are countries investing in clean energy? How much is growing or decreasing low carbon and high carbon industries? How many funds are being divested from fossil fuels? The values of fossil fuel subsidies and countries that are eliminating subsidies. As you can see, it's very little countries that are not financing fossil fuels, and production and consumption-based attribution of emissions. And this is a new indicator, is the compatibility of fossil fuel company strategies with the Paris Agreement, which basically there is no compatibility in summary. So everyone more than welcome to have a look at these indicators.
Okay, thank you, Marisa. It's interesting for me. The participant who would like to share or ask question to Marisa.
Maybe I don't know if they can write the question, because I don't know if they can open their mic.
No have question in the chat box. Okay. I think your work is very interesting. Maybe I will visit your website, and I'm not sure I can see the data of Thailand. Okay, maybe
Yes,
I will. Thailand. Okay.
absolutely.
Okay, thank you, Marisa. If no have anyone share about the first keynote speaker indicator monitoring and reporting in climate change. I will continue. I would like to share my work. Maybe I think link from Melissa's work. Okay, I would like to share my. Okay. Okay. This topic I would like to share about health impact assessment and a tool for climate change policy process. First, I would like to understand the basic term of definition because I think that maybe in Thailand context, I define the term of definition different from general. About health in Thailand, health means the state of human being which is perfect in physical, mental, social, and spiritual aspect. All of these are holistic in balance. Spiritual means the comprehensive knowledge and consent leading to kindness and sympathy. This means that health is not the physical health, disease or illness, but also it include the dimension of social, mental, and spiritual. Health was influenced by determinant of health. Determinant of health means the condition in which people are born, grow, live, and work to the end of their life, including factors and systems that shape those conditions such as policy, economic system, development direction, social norms, social policy, and political system. All of these have an importance on the health of the public. For this picture in the Trenton is at the individual level of determinant of health, such as biological characteristics, age, gender, genetic illness, and then affect the behavior of the people, such as physical activity, food consumption. Okay, in the way it environmental level consists of physical, biodiversity, then land use, natural resources, maybe climate change, maybe in a environmental level, and the blue is the social common direction level. This is the example of determinant of health with affect health status. If we like a logic of development and health, the policy, program, project, or activity may be change or affect determinant of health. Such as individual factor, environment, system, and mechanism. The rank of personal, social, economic, and environmental factor which determine the health status of individual or population is a determinant of health with affect health status or well-being. Health impact assessment is a way to predict this health impact in order to recommend improve the policy and improve health status. It means that if development by policy change determinant of health and affect health, we have to improve the policy in order to improve health status. Okay. For example, about climate change cause and effect, the policy or activity about agriculture, fossil fuel maybe affect determinant of health, such as maybe occur greenhouse gas, global warming, climate change, then effect on environment, maybe affect habitat distribution, or maybe biodiversity loss, economic system collapse, intensify weather event, heat, storm, flood, drought, wildfire, and maybe affect food security or the other factor, and then affect health status. This slide mean that the determinant health is not a logic, but maybe complex, many factors, and then affect health status. When we have to assessment the indicator, we have to choose the significant or the important indicator because we cannot assess all of indicator. Okay. What is impact assessment? Impact assessment is a planning and decision tool used to assess the potential positive and negative effect of policy. Impact assessment help us to understand the possible impact of policy in order to maximize positive policy impact and minimize negative impact. There are more than 140 types of IA systems in worldwide, such as environmental impact assessment, health impact assessment, cultural impact assessment, many impact assessment. About health impact assessment, I think there are two main streams of health impact assessment. The first one, health impact assessment, that's part of the other impact assessment system, such as environmental impact assessment or environmental health impact assessment. In Thailand, the type of assessment this stream have to do because the regulatory, and the second stream, health impact assessment as a tool for public policy. I will focus the HIA at this stream for today. What is health impact assessment? In Thailand, we define health impact assessment is a joint learning process of society to analyze and anticipate both positive and negative impact on health of the people that may result from one of or a combination of policy, program, or project when implemented at the same time or the same area by applying various tools and appropriate participatory process in order to support the decision making that will benefit health of the people in both the short and long term. Public policy means the direction or guideline that society at large agree with or believe should be taken accordingly, including written policy set by the state. I mean that the public policy, not only the government policy, but also it include the policy with conduct from the community or local government. The HSA process consists of 6 steps. The first one is public screening. The second, public scoping, assessing, public review, influencing, monitoring, and evaluation. 8 steps of HSA. There is important question of a step. For public screening, the patient have to answer, need to evaluate or not, why? Need to conduct HA or not, why? The second, what are the key indicators? What are the important determinants of health with effect by the policy or program? With vulnerable group, area, time, or what are the methods to conduct or assess? The assess, how to assess, how to use qualitative or quantitative method. Public review have to answer, evaluate accuracy, competence, or not the result of assessment were present in the committee and make comment. Influencing, what are the results of the evaluation to adjust the activity or set measure implement of the project, and monitoring, track implement to measure. This is a 6 step of HIA. How to conduct HIA? The first step, public screening. Public screening, what to do? Open window of opportunity to decision-making process and connect to the public through public disclosure and public plan project and activity, and then provide open space for various sectors to dialogue, present info and view, and collective consider whether or not to conduct HIA. This process able to answer the question and explain results to public about the concern, what or not to do HIA, if not, why, and if so, in what way and by what method. The outcome of this step is that the agency responsible for implementing the policy can answer the question to the public with the result, whether or not to conduct, to should undergo HIA, if not why, what the result, if so, what way, and what method to follow. The second step is public scoping. In the public scoping, when we conduct a public scoping, we should integrate the community and technical scoping. What to be done? Inform the public in order show info openly and comprehensive, using language, illustration, easy to public to understand, and provide opportunity to express opinion and hear very voice with open mind. Public scoping target to inform info, to hear view, to understand the community, to see connection, to know how conduct a HIA, what to get from the process. The first, understand concern of public or stakeholder about the policy, what the community, society, attack value significant to determine of health. See how policy connect to determine of health, know what HIA option and what to follow. The third step is assessing what to do. In the assessing process, we using technical, scientific, and community tools. Have to study determinant of health of the community, study time format of the policy, plan, project, activity implementation. This step can answer the following question. The first one, how will it affect determinant of health, both positive and negative, and how will be change be brought about? The fourth step is public review. In the public review step, what to do? We have to present finding openly and completely using the language illustration that public can understand, allow opportunity for exchange of info from every sector and hearing with open mind. What to be obtained? Have to review and examine whether the finding are complete or there are any other issue to further study. See implementation option and potential outcome from each option in a clear-cut manner. The fifth step is influencing. Influencing, we must do present finding and implementation option of the policy using the language illustration easy to understand and see potential outcome from a decision option clearly. Channel to presentation, the first one, government agency, committee, dialogue forum of various sector, public media. Time for presentation before, during, and after implementation policy. What to be obtained, commonly accepted decision, guideline to influence decision. And the last step of HIA, public monitoring and evaluation. What to do? Design monitoring and evaluation guideline and working group. Set the scope issue for monitoring and take action to design, report, monitoring and evaluation finding to the public. It to be often should whether or not implementation of policy, plan, project, activity lead to expect outcome, and what is the health impact on the public. Summary and then summary and monitoring and evaluation. The policy process. The policy process consists of policy formulation, policy alternative decision making, policy implementation, policy evaluation, or maybe policy terminate. HIA can use on of policy process. How to integrate HIA in public policy process to ensure that the implementation of public policy process positive outcome to the well-being of the people in society on the basis of participant and collective social learning. HIA of the policy at all levels should be undertaken using following 4 core concepts of HIA application. The first one we call proactive HIA, conduct HIA before develop public policy. Ongoing HIA, conduct HIA while concurrent policy. Conflict and complaint resolution HIA, conduct HIA when receive complaint, and the last HIA for sustainable. For the first one, proactive HIA. Proactive HIA, we have to set a space for dialogue in order to screen information and HIA formulating forum and then design a plan for conduct HIA together. The design have to anticipate and set time frame in the with policy related decision process. The recommendation that bring about positive outcome of the health of the people can be incorporated into the policy from the outset. Sector concern in this stage consist of policy formulator, project owner, the positive or negative effect people, local agency. Okay. The second is ongoing HIA. Ongoing HIA design HIA that can be connected to decision-making process in public policy. We can use before, during, and after implement policy. HIA in connecting with the process of public policy formulation can be applied in so many ways, such as to develop and process policy options, to compare potential impact between various policy options. A good HIA process therefore must be designed in such a way that it fits and falls in line with the public policy concern. And the third, conflict and complaint resolution HIA. This model of HIA in public policy, the sector concern may be considered policy setting, project owner, positive or negative effect people, academic expert, local agency, approving agency, regulating, monitoring agency. Step the first, regulate health impact assessment direction, or maybe setting a steering committee in order to set scope or issue, consider option, organize public hearing, select assessor, examine public review draft report, and set time frame budget. Then when select assessor, the second assess and analyze impact, use diverse tool, information, technical, scientific community, and then examine and public review draft report, regulating committee to find appropriate format. The last HIA for sustainable highest target for development is to create a good health or well-being of the people. HIA that we expect must attach important to immediate to potential positive and negative impact on determinant of health or immediate accumulate long-term impact. Important giving first and foremost the impact that cannot be resolved. Avoid action totally leading to impact differently. And then consideration of the option to implement policy plan project, strategic level, technical level, project size and area level, technical action guideline level. The last must be to consider context, way of life, determinant of health and development direction of people in the area. Okay. For my presentation, I would like to show that HIA health impact assessment can be used for evaluate climate change in both before conduct a policy related to climate change. Okay, I'm not sure I have someone to share with me. Melissa or another participant. who would like to share with me? From is health impact assessment covered by regulation in Thailand? Yes, in Thailand, the health impact assessment is two mainstream. The first one, HA as part of EIA or HA, we have to conduct because the regulatory. But the second way, the HIA is in National Health Commission Committee is an alternative in Thailand to conduct HIA for public policy process. Okay. Thank you for your patience. Okay. Are there some question from another who would like to share with me? How about the impact assessment? We have time. Anybody? Some patient? Okay, if no have anyone, I would like to thank you on participant for this section. Okay, thank you.
Is it finished? Okay.
Okay.
I guess we can finish. Yes, there were no questions for this session.
Okay.
Thank you for participating, both Fen and Marisol, for this Congress.
Okay, thank you very much. Thank you.
Thank you, everyone. Have a great day and all the best for the rest of the Congress.
Thank you
Okay,
so much.
Thank you.